Hello, my name is Julie Jezykowski. I am in my third year as an undergraduate student at Marquette University. My major is in biochemistry and molecular biology with a minor in psychology. I work with Dr. Elizabeth Angeli, a technical communication professor and a formerly licensed emergency medical technician, on several projects surrounding emergency medical services report writing and curricula. I myself am also a licensed emergency medical technician and have found these projects particularly meaningful because, in my own experiences, report writing was not something that was heavily focused on in my training, but rather something I learned along the way while working. Another project I am working on suggests that 65% of providers feel less than adequately prepared for the writing they do on the job after their training. In pre-hospital settings, the patient narratives have an often overlooked rich synthesis of decision making. The components of a typical report include a list of assessment and intervention details, as well as a narrative written by the provider. It is a vital component of the patient care continuum, and writing studies can offer much to healthcare to restore the story. By looking at pre-hospital reports specifically written by emergency medical services providers, the research I have been a part of identifies report characteristics that in turn can advance patient care. As such, the leading research question asks, what do report readers look for in pre-hospital reports to be convinced that the report is effective and persuasive and can help facilitate patient care? 12 professionals, including medical directors, attorneys, and nurses, were asked to interview and read pre-hospital reports, ranging from a cardiac arrest to a pediatric fall, and shared their views on the quality of the report. These professionals read reports on a weekly, if not daily basis, to continue patient care in the hospital for billing or organ donation purposes, or to prosecute or defend in court. The interviews were coded in vivo using grounded theory by a research team who are all EMS providers. Four codes emerged: scene details, which includes time on the scene and bystander statements; patient details, including assessment of injuries and patient statements; care details, like interventions performed and transport information; and lastly, reports credibility, like pertinence of information and talk of detail. These codes showed both a lack of justification for the provider's actions and detail in the reports, making it difficult for the readers to not come up with hypotheticals to fill the gaps in their mind. The inter-rater reliability, or Cohen's kappa, is still being calculated between the research team. This study is important to the field of writing studies because it will allow for advocacy for a better professional and technical writing curriculum inside both academia and inside the EMS workplace. By investigating professional writing in pre-hospital medicine, our research promises to impact other healthcare writing fields by suggesting more robust heuristics to teach healthcare writing aside from common mnemonics.